when it comes to like jobs and when it comes to, we're so used to this process. I went to school to be a nurse and this and that and this. That's what I do. If this comes out, and we've looked at some of these technologies, and it doesn't make them obsolete. It just, and I've tried explaining this to some people because of the knowledge that I have, what little knowledge I have. But it's no, this is a tool to alleviate the pressures that you're facing right now when you're doing a 12, 14, 16-hour shift because you're just bombarded with these people. Is there still a pushback that you feel on your guys' end, especially from Health City and the ecosystem that you're in? Are you seeing a pushback?
The pushback is interesting. So it's, I think it's played up by sometimes in the media, sometimes in other venues. But, when I talk to frontline clinicians, they're users of technology on their regular basis, right? So I'm talking to nurse practitioners, I'm talking to LPNs, RNs, physicians who are saying, you know what, it would be great if I'm able to, if a patient's able to give me a quick call and I could, correct them on their dose or correct them on something that they need to do or check in with them on something. It'd be easier for me, it'd be easier for them. We just need the back end systems for that.
Right.
I think that there is some fear mongering around because you'll hear stats about, X percentage of jobs that exist today won't exist 20 years from now. And sure, that scares people, but we have to see that we've already gone through these changes.
Yeah.
So, you brought up earlier, Bryce, the fax machine. So you have an admin assistant that was working in an office environment 20 years ago, maybe faxed things, right? But now that individual is able to do that far more effectively because instead of sending 100 faxes, right? Because that's what we would do on dial-up to 100 different phone numbers.
Yeah.
You can actually just do a global email, send to everybody on the list to 100 people at the same time. It's the same admin assistant. What's going to happen though is that because that job, which probably used to take a day, now takes 5 minutes, that admin assistant can actually add value in other ways. And that's how I see technology is going to help us. And that's how it's been happening. When we look at the computer revolution, it's the same thing that's going to happen with AI. It's going to make us to be able to do more valuable work. It's not necessarily going to get rid of jobs, but it will get rid of certain tasks.
Yes.
Right? And certain tasks that we do in jobs will get a lot easier. So there's a great example. I think Jason Pincock might have talked about this when he was talking about his incubator and some of the work that he's doing at Dynalife.
Yes.
Where they're working with AltaML to screen samples for colon cancer, right? Right now, you've got a very expensive pathologist that's looking at every sample, and a number of those samples are negative.
Yeah.
Well, if you had a computer helping just to rule out what are the negative ones, and then allow the pathologist to look at the more complicated ones, you're saving a lot of time, right? And that is a relatively, I'm not going to say easy, but it is straightforward to be able to make that determination between saying this cell type does not exist. So that's a clean sample. So instead of paying a pathologist hundreds of dollars an hour to look at that, just run that through a system and then focus on the ones that require that pathologist to be able to look at that, analyze it. And so now, again,
it's effectiveness.
It's effectiveness. You're not getting rid of the pathologist.
Right.
What you're doing is you're making the pathologist far more effective.
Yeah.
And
turning results over faster. Because they're not wasting their time with a bunch of negatives. They're getting right to the source.
And on any field in health right now, there is a lineup.
Yeah.
Right? There's a lineup for
the door.
Imaging. There's a lineup for surgeries. There's a lineup for this. There's a lineup for that. So I can tell you that none of these people that are working in healthcare, they're not going to lose their jobs. The demand is there. They're just going to end up being far more effective. So the answer is, one, I don't think they're going to lose their jobs. Two, they're going to be far more effective. The folks that I'm speaking to in the field, they want the technology to come into play. They really do, because they feel that they can provide better care and better access to their patients.
Yes.
That's what they want to do. That's why they joined this career in the first place, to provide care and access to their patients, right? That's what they want to do.